What is Pyrrole disorder? Pyrrole disorder, or pyroluria, as we call it, is an abnormality in chemistry that results from an overproduction of what we call pyrrole molecules. Now, these molecules are normal byproducts of hemoglobin production. That's the stuff that's in our red blood cells that carries oxygen, and other processes in the body. Excess pyrroles have actually little or no function in the body itself, and they are effectively excreted in the urine. That's how the body gets rid of pyrrole molecules, through the urinary system. However, pyrroles can have a very strong affinity for elements like zinc, and they can contribute to zinc deficiency by increasing the urinary loss of zinc molecules. When elevated in the urine, they represent a very functional marker, a marker for real deficiencies in vitamin B6 and in zinc as well. Let's talk a little bit about the history of pyrrole disorder. In 1958, the ever so brilliant Dr. Abraham Hoffer, MD, PhD, first detected the Mauve Factor, or Mauve. He named it that because of its appearance, color on paper chromatograms in the urine of patients who were schizophrenic at the time. And he found great success in treating these individuals with large dosages of vitamin B3. Now, note, that's treating the schizophrenics, not treating the pyrroles or the Mauve factor there. In 1965, O'Reilly reported Mauve elevations in affective psychosis, in an alcoholism, psychoneuroses, and behavior disordered children. In 1971, the eminent Dr. Carl Pfeiffer, MD, PhD, a pioneer, a true pioneer in his own right, and his team discovered the clinical response of high Mauve subjects to vitamin B6 and zinc therapies, and they saw remarkable improvements in a series of 1,000 patients. That was just the beginning. Researchers later identified Mauve as hydroxyhemopyrrolin 2,1, or HPL, referred to as urinary pyrrole, or simply pyrrole, a hemoglobin metabolite that binds with pyridoxine, that is vitamin B6, and zinc. By the late 1980s, Carl Pfeiffer and Dr. William Walsh, PhD, discovered that supplementation of PLP versus vitamin B6 appeared to benefit nearly all B6 deficient patients, and this is the practice that we still use today. Let's talk about pyroluria and oxidative stress. Most mental disorders involve oxidative stress, and elevated pyrroles may be secondary to a number of other biochemical conditions as well. Excessive release of free radicals can destroy cells or impair biochemical processes. Pyrrole is a natural organic chemical containing a 5-membered ring, usually what we call a benzene ring, with a chemical formula of 4 carbons, 4 hydrogens, a nitrogen, and another hydrogen bonded. Pyrroles are involved in the production of heme, which is the primary constituent of hemoglobin. They have an affinity for binding with PLP and zinc, as we mentioned before, resulting in transported out of the body together with the pyrroles. Now, more than 90% of patients diagnosed with depression, behavior disorders, ADHD, autism, and schizophrenia exhibit depleted plasma zinc levels. Therefore, we see severe oxidative stress can deplete the zinc that's stored in the human body. Let's talk a bit about vitamin B6 and zinc deficiencies. Vitamin B6 in the form of PLP is needed for the production of dopamine, one of the neurotransmitters in your brain. It's a brain chemical, as well as GABA, which actually stands for gamma amino butyric acid. A genetic or acquired deficiency of vitamin B6 can result in an abnormally low level of these important neurotransmitters and a myriad of problems including ADHD, depression, anxiety, and sleep disorders. In addition to the production of B6 is involved in more than 80 different biochemical reactions in the body. Vitamin B6 deficiency can produce physical symptoms including nervousness, insomnia, and muscle weakness. Zinc also has many important roles in brain function and is required for the efficient conversion of dietary B6 into PLP. It has a special role in the activation and inhibition of NMDA receptors that are essential to good mental health. Now, folks, let me just share with you. The NMDA receptor is a point in the brain where a great number of neuromodulatory systems are working to affect functionality. It's been the subject of tremendous research in OCD, in anxiety, and depression, all referenced in the American Journal of Psychiatry. So this has been a very, very key area that a tremendous amount of research has focused on. And one of the things that zinc has a very important role at the level of this receptor site. Zinc deficiency also results in altered brain levels of GABA and can cause copper overloads that alter brain levels of dopamine and norepinephrine. It is also associated with delayed growth, temper control problems, poor immune function, epilepsy, hormone imbalances, neurodegenerative disorders, and learning problems. Let's look at conditions where we see high incidences of Pyrrole disorder. Alcoholism, autism or Asperger's syndrome, anxiety disorder, antisocial personality disorder, ADD or ADHD, bipolar disorder, criminal activity or criminal behavior, depression, Tourette's syndrome, Down syndrome, epilepsy, learning disabilities, mood swings, neuroses, psychoses, oppositional defiant disorder, substance abuse, and even schizophrenia. Now, I want to pause here for a moment because I want to make it very clear. Pyrroles do not cause most of these disorders. Pyrroles are actually exacerbated by these disorders. We'll talk more about that later on as we progress with the discussion. Let's look at the incidence of pyrrole overload or too many pyrroles in different clinical populations. This goes back to the study by Dr. Walsh from the Walsh Research Institute and his database of over 30,000 patients. What he found was that approximately 18% of individuals with ADHD had high pyrroles. 28% of individuals with behavior disorder also had elevated pyrroles. For autism, it was in the range of 35%. Depression was approximately 24%, disorder 35%, schizophrenia 30%, post-traumatic stress issues 12%, Alzheimer's disease 14%, and healthy controls approximately 8%. Let's talk a little bit about the symptoms and traits of pyroluria. Most pyrolurics experience at least 50% of the following symptoms and traits, and some are more boldly represented than others, and I want to stress for you why. The ones that are extremely well bolded, I want you to remember as being very, very key and more specific than not for pyroluria. Firstly, poor stress control. Extreme incapacity to deal with stress is a very common symptom of Pyrrole disorder. You'll see also elevated cryptopyrroles in the urine upon testing. But individuals who are also very sensitive to bright lights for many pyrolurics. Not everyone, but many. Morning nausea, a tendency to skip breakfast, acne or very dry skin, pale skin, inability to tan, high irritability and temper. That's called, I call it the rage, the Bruce Banner Incredible Hulk syndrome. It's that kind of anger that just kind of shifts or turns on, like when someone cuts you off on the expressway and immediately you get irritable and you want to strangle them. That's the kind of irritability and temper we're referencing here. I call it going pyrrole. A history of underachievement can be present, sometimes little or no dream recall. Various autoimmune disorders can often be seen with pyroluria as a result. Signs of pyroluria, you might see white spots on the fingernails. An indicator of pyroluria might be poor growth, coarse eyebrow hair, stretch marks or stria on the skin. Severe depression may also be a symptom of pyroluria. Fear of airplane travel, tornadoes, in other words, excessive worrying. Obsessions with negative thoughts, delayed puberty, dark or mauve-colored urine. Any of these can be signs or symptoms of pyroluria, but not all of them are exclusive to pyroluria. Let's talk about other symptoms and traits. Severe oxidative stress is usually a common cause of pyroluria. Poor short-term memory, sensitivity to loud noises, that's a very key one. Affinity for spicy and salty foods, an abnormal fat distribution, usually heavier around the midsection. Delicate facial features, extreme mood swings, that's a real big one. Extreme mood swings are a quintessential sign that perhaps someone should be tested for pyroluria. A history of a reading disorder, severe inattention, frequent infections, premature and gray hair, abnormal or absent menstrual periods, poor muscle development, a fruity breath or a body odor, pain in the area of the spleen, that splenic pain, a stitch in the side that many people complain about. It's often related to pyroluria. Severe anxiety, histrionic behavior, joint pains, poor wound healing, psoriasis, an abnormal sleep cycle. Abnormal EEGs can also sometimes be correlated with Pyrrole disorder. Bipolar disorder or Pyrrole disorder. When we look at the study that was done by Dr. Walsh, PhD, at the Walsh Research Institute, he indicated that bipolar patients fit into 4 major biochemical classifications based upon his chemistry database of over 250,000 assays and 1,500 bipolar patients. They include undermethylation, overmethylation, copper-zinc imbalance, and Pyrrole disorder, referencing severe oxidative stress. In our clinical experience, patients with extreme highs and lows or rapid cycling bipolar disorder type symptoms often exhibit severely elevated pyrroles. Let's talk for a minute about severe oxidative stress and schizophrenia. About 30% of schizophrenic patients show severe pyroluria, and this condition involves free radical oxidative stress and depletion of protective proteins. Oxidative overloads from any source can cause psychosis in sensitive individuals by actually lowering glutamate neurotransmitter activity at that receptor we spoke about before, the NMDA receptor in the brain. Levels of glutathione, especially needed for efficient NMDA function. Many individuals who talk about glutathione are usually in the autism community, and they're very well referenced with the idea that low levels of glutathione tend to be very destructive to neural pathways and neural tissue and the overall cognitive progression for children in the spectrum. So having protective glutathione on board is very key in the battle against oxidative stress. So we see that when oxidative stress depletes levels of glutathione, there's also a correlation that's needed for efficient NMDA functionality. Biochemical markers for this condition include elevated pyrroles, low plasma zinc, depressed serum glutathione, as we talked about before, elevated non-ceruloplasm serum copper, and many others. Pyroluric schizophrenics may have a combination of delusions as well as auditory hallucinations. The onset occurs during a period of extreme stress, quite typically. Children with Pyrrole disorder. Pyrrole disorder, as a distinctive biochemical imbalance, is often exhibited in children and adolescents with ADHD, autism, Asperger's syndrome, anxiety, Tourette's, behavioral disorders including oppositional defiant disorder, or ODD, fears and phobias, sensory processing disorders, learning disorders, and those with normal growth cycles, that namely the terrible twos and adolescence. Folks, if you can remember back that far, if you've got kids out there, you know that these 2 categories of individuals kind of behave somewhat similarly. They have low stress tolerance, and you don't necessarily know who they are or who they're going to show up being in the next 5 minutes. Especially true around age 16 and age 2. Symptoms include high irritability and temper, poor stress control, frequent infections, poor short-term memory, sensitivity to light and sound, as well as odor and texture. Physical signs include white spots on the fingernails or that sweet or fruity breath we spoke of earlier, sometimes pale skin that burns easily, and oftentimes poor wound healing. In teenagers, depression and pessimism, severe mood swings, or even a prior diagnosis of bipolar disorder, Pyrrole disorder is quite common. Oftentimes, these individuals withdraw socially and they have a tendency to stay up late. Let's talk for a minute about the DSM-5, that is the manual, the Bible, if you will, of the psychiatric community. The question about temper dysregulation disorder. This is a new diagnosis that they've come up with, and will partially out of concern that the diagnosis of bipolar disorder in children may have become far too popular amongst many psychiatrists. It's now been proposed that a new diagnosis, known as temper dysregulation disorder, has come into play. Severe tantrums, bizarre shifts in mood and behavior, and poor response to small stressors are some of the symptoms, including a prior diagnosis of ADHD, learning disabilities, and oppositional defiant disorder. These symptoms and traits strongly correspond to pyroluria, and we encourage parents to test these children for Pyrrole disorder. Children being treated for Pyrrole disorder may respond quickly to nutrient therapy, and improvements are often reported during even the first week. Now that's often, not always. Let's talk for a minute about pyroluric depression. A double deficiency in zinc often results in a tendency for low brain levels of serotonin, dopamine, and GABA, which is a recipe for both depression and anxiety. Female pyrolurics may report disturbed menstrual cycles or even amenorrhea, which is the absence of menstrual periods. For both males and females, they're often prone to delayed puberty and significant growth after age 16. Other symptoms include severe inattention, short-fused reactions, poor immune function, morning nausea, migraines, fatigue, insomnia, reading disorders, and academic underachievement regardless of intelligence. As a genetic condition, it often runs in families. If you find yourself behaving quite similarly to your hot-tempered parent, you may want to consider being tested for pyroluria. In many cases, depressed persons exhibiting more than just one biochemical imbalance is the case. So it's not as though Pyrrole disorder is the only imbalance that's present. Oftentimes there can be several, whether it comes to depression or anxiety or any other cognitive disorder. Speaking of other nutrient imbalances, we have a genetic or epigenetic imbalance in a nutrient that can alter brain levels of key neurotransmitters and result in abnormal brain chemistry. Part of that can be a methylation issue, which we'll get to later, or sometimes even an inherited copper deficiency, or copper overload, which we'll talk about very soon. Vitamin D deficiency has been associated with depression, schizophrenia, ADHD, and other mental disorders. Undermethylation, that is a methyl deficiency, is also eating disorders, obsessive compulsive disorder, or OCD, but it has a very interesting personality trait. That personality trait tends to be perfectionism, and leading ultimately in its most pathological form to super perfectionism, which can never really be fed. Patients with overmethylation, on the other hand, often tend to have a folate deficiency. Now, they also have a tendency for high anxiety, panic disorder, depression, including sensitivities to pesticides, toxic chemicals, and even certain foods. Copper overload also tends to have its effect. It tends to lower dopamine levels and increase levels of norepinephrine in the brain. Imbalances in these important neurotransmitters have been associated with paranoid schizophrenia, ADHD, bipolar disorder, postpartum depression, very, very big, and violent behavior. Fatty acid imbalances have also been associated with depression, ADHD, schizophrenia, bipolar disorder, and dementia. What we want to share is that it's not usually about one imbalance, one deficiency, or one excess in most conditions. There are often groups or several different imbalances that are present that lead to many of the diagnostic phenomena that we often are so plagued with at our offices in medicine. Genetic or epigenetic? Some persons have a genetic or an acquired tendency for very elevated levels of pyrroles, which can result in a deficiency of both B6 and zinc. A genetic pyrrole disorder can result in low serotonin and GABA levels, and SSRI antidepressants and may be beneficial, typically in those cases. However, targeted therapeutic dosages of supplements may provide similar benefits without medication side effects. Now, since pyrrole disorder is actually a marker for oxidative stress, there may be an increased need for vitamin B6 and zinc under these types of circumstances. It is quite likely that the symptoms of pyrrole disorder will recur if nutrient-based therapy is actually stopped. So you can't just take it, feel better, and then move along your merry way. It typically needs to be continued. Furthermore, since stress, illness, and injury all exacerbate zinc deficiency and pyrrole disorder, individuals respond to treatment more rapidly when these factors are absent and may relapse in times of stress or illness. Because of genetic variations, pyroluria may have a variety of outcomes. Everyone is biochemically unique. Let's talk about some common myths and some common facts here about pyrrole disorder. First of all, fact. Severe stress is a cause of pyrrole disorder. Stressful life events or trauma increases associated symptoms and excretion of pyrroles. Myth. So far, we know that in medicine, we've been really lauding or pushing omega-3 fatty acids as though they're good for everyone. And that's actually not the case. Individuals with pyrrole disorder do not do well on omega-3 fatty acids. So omega-3s are not good for everyone. Fish oils are not good for everyone. They're good for a significant number of the population. However, for those with pyrrole disorder, this can be a problem. Fact. Individuals tend to worsen if given fish oils, DHA, EPA, etc. And the reason for this is that they typically have a problem in the processing of arachidonic acid. Now, we won't get too much into that pathway, but that's a key point I want you to remember. Omega-3s, not good for everyone. Myth. Pyrrole disorder causes thyroid disease. I remember during another webinar, someone brought this up as though it was a very matter-of-fact point, and I had to say this is not the case. Pyrrole molecules in general do not cause organic disease. They are in fact reflective markers of oxidative stress caused by organic disorders like thyroid disease, like cancer, like sickle cell anemia, like broken limbs, colds or flus, or even emotional turmoil or trauma. Furthermore, correcting pyroluria in these cases will not fix the organic syndrome. That's something I want people to remember out there. That's been a very big misconception. Pyrrole disorder does not cause organic disease. Pyrrole disorder may be responsible for cognitive changes in mood, behavior, and irritability, and stress intolerance, but it does not cause actual physical or physiologic disease. Another fact. The symptoms of pyroluria are frequently mistaken for signs of other psychiatric illnesses, mental or behavioral disorders. Misdiagnosis is very common. When an individual is under the care of an experienced physician with appropriate laboratory testing, nutrient therapy treatment programs can dramatically improve the individual's symptoms and quality of life. Myth. Treatment for pyrrole disorder is a complex of multiple micronutrients. Fact. Treatment of pyrrole disorder requires therapeutic dosages of key micronutrients only. Testing for pyrrole disorder. Pyrrole disorder is diagnosed by finding elevated cryptopyrroles in urine. Laboratory testing will indicate whether an individual has a numerical pyrrole disorder. Interpretation and correlation of a patient's medical history, symptoms, and laboratory tests together will allow for an accurate diagnosis of pyrrole disorder by an experienced or trained physician. Oftentimes, borderline cases are seen by test result and do not alone indicate pyrrole disorder in an individual. We utilize direct healthcare access to labs for pyroluria testing. They are the only laboratory in the U.S. that actually reports both actual and calculated. The calculated results compensates for things like concentration changes in the urine specimen, therefore allowing for really a much more accurate test result. Treatment for pyrrole disorder. Pyrrole disorder is corrected by supplementing individualized therapeutic dosages of vitamin B6, pyridoxine 5-phosphate, and zinc, and other supportive nutrient elements, for example, vitamin C, vitamin E, and evening primrose oil. If no other chemical imbalances are present, individuals with mild or moderate symptoms of pyrrole disorder may see a response to treatment within about 2 to 4 weeks. That is, starting the improvement process, not the full completion. Individuals with more severe symptoms usually require 1 to 3 months before some improvement is seen, with greater improvement occurring gradually over 3 to 12 months. Now, I want to pause here to emphasize something. You cannot just take random levels of supplements and expect to get better. You have to have actual targeted nutrient dosages by, once again, a skilled or trained practitioner to help move you along properly in this phase. Supplements are not necessarily benign entities. In higher concentrations, they can cause difficulty or damage, and it takes a skilled physician to modulate that process for you and to help you move along safely. Okay? Now, I wanted to tell you just a little bit about, if you're not familiar with any of these things that we're talking about here, Dr. William Walsh's new book, Nutrient Power, Heal Your Biochemistry and Heal Your Brain, is available as a wonderful piece of introduction as well as greater scientific detail for ideas involving nutrient imbalances and their effect on not only brain chemistry but behavior and different conditions as well. Dr. Walsh is absolutely one of the greatest minds and probably the father of methylation, really, of this century. So if you haven't picked it up yet, I would suggest picking up the book Nutrient Power. I think you'll be very, very happy and impressed with the information that it provides.
Great. Well, at this time, we would be happy to take some of your questions. So please take a moment to type your questions into the question box located in your control panel. And our first question for you, Dr. Mensah, is, why do some people have pyrrole disorder by urine test but no symptoms?
Very, very good question. Now, for some people, it may be that they don't recognize the symptoms. It can be a very low-grade symptomatology for certain individuals, especially those who compensate well. We know that as we get older, from childhood to adulthood, we learn how to modulate our behaviors and to control them. Many of us may not even recognize that we have inner tension or anxiety. We may come home every other night and have a little glass of wine to help settle us down from a busy day, or a martini, as we've seen in the movies. So that's one piece to that puzzle. Secondarily, just because you show up with a pyrrole disorder on testing doesn't mean that it is, as of yet, manifested in the symptomatic framework. Many individuals who exercise, who do yoga, who do a variety of elements to help produce a little bit more calming in their lives may simply not be aware that they've got symptoms of pyroluria. Signs of pyroluria tend to be a little bit different. Now, looking down at your fingernails and seeing white spots is definitely a sign that, and it could also be an issue regarding perhaps pyrroles may be there, irrespective of how you compensate. Sometimes we're very good at masking our own feelings.
If a parent has pyrrole disorder, what are the recommendations for testing their children? Does someone need to have symptoms to have a positive test?
Well, the first part is that if a parent has pyroluria, I would look at the behavior of the child. If the child seems to be behaving somewhat similarly, or in other words, if this looks like a chip off the old block here, then indeed I would have the child tested. Part two, Dana, was?
Do they need to have symptoms to have a positive test?
No, symptoms don't actually have to be present in order to have a pyrrole test. Looking at families, as we have with so many of our patients, I remember two distinct cases where one younger brother had pyroluria and had tremendous symptoms versus his older sister who was moving along through life swimmingly. And I can tell you it's very interesting that she had the worst case of diarrhea, the worst case of the two, but she displayed very few symptoms. But she was highly active, highly involved, and engaged in a number of activities which would lower anxiety and decrease stress in her life. So for her, it simply wasn't manifested.
Does post-exercise exhaustion happen in an otherwise fit lady because of pyroluria? It seems that on the days that she works out very hard, she's very exhausted, and even more so in the evenings.
Well, that's a very complicated question because that could be anything from lactic acid buildup to true muscle fatigue to a variety of other things. That zinc is a very key element in endurance, in survivability, and a variety of things. And if you are indeed zinc deficient, that can lead to poor stress capacity. So exercise is a stressor. It's a physiological stressor, but it's also emotionally uplifting for many people. So the real question is that this is a multifactorial phenomenon, and we cannot say that that is the key reason why she fatigues so easily. Everything from physiological conditions, from inflamed muscles and joints with lactic acid buildup to acidosis, a variety of things come into play, and not just pyrrole disorder. Now, pyrrole disorder may be a result of all that exercise due to inflammation, and you might see an inflammatory marker like pyrroles rise because of that inflammation, but it's not necessarily reference to exercise fatigue or lack of exercise endurance.
I am a 37-year-old woman diagnosed with severe pyroluria in 2006. Over the past 25 years, I've been either taking carbamazepine or oxcarbazepine, so sorry for seizures. When I started reducing the AED oxcarbazepine in September 2013, known by its brand name Trileptal, my body reacted by resulting in peripheral neuropathy. My daily dosages were 200 milligrams of P5P, which have now been reduced to only a small dose of 50 milligrams of P5P. Is the vitamin deficiency condition pyroluria a known side effect of any medications, such as these that I've been taking?
Not likely, but I would like medications that are anti-seizure in nature will deplete your body of zinc. Now, because zinc is one of the elements that is deficient in pyroluria, you can often see overlapping symptoms between pyroluria and zinc deficiency. Depakote, for example, can cause severe zinc deficiency. So many people may feel as though they're pyroluric because of how they're responding to Depakote. But in actuality, it's a zinc deficiency that's being produced by the use of Depakote. Most of these medications will not cause a pyrrole disorder in and of themselves, but they may affect micronutrients like zinc.
By use of the paleo low FODMAP diet food list, I have reduced my pyroluria symptoms significantly and am able to eat more foods by avoiding FODMAP foods and wheat. How do nightshade foods, wheat, and additives cause pyroluric reactions in people, such as moods, psychosis, seizures, etc.?
Okay. Once again, this is an issue about the fact versus the myth. These food stuffs that are often actually antihistaminic in nature or moving along the anti-inflammatory side of things, they don't cause pyroluria. These foods, when ingested, often cause inflammation of the gut, inflammation in the system, and that can cause pyroluria. But these foods themselves do not elevate pyrrole molecules. It's the entire process of inflammation and oxidative stress that further worsens the production of pyrrole molecules. So we have to be careful about cause and effect. And the reason is because if we presume cause, then we expect that when we treat that cause, we're going to have the appropriate effect, which should be resolution. And that simply is not the case. So treating pyrrole disorder is not going to affect the change you want, that these foodstuffs basically produce the pyrroles. So it's quite the opposite. It's more of an indirect effect by way of inflammation and oxidative stress from these particular foods.
Should people with pyrrole disorder be on a vegetarian or vegan diet?
Oh, one of our favorite topics, diet. Pyrrole disorder is really not an indicator as to whether or not a vegetarian or a vegan diet is appropriate for the individual. Dietary considerations are highly specific to the person. There's no blanket general statement that everyone should be this or everyone should be of that. You know, not all people are designed to be bunny rabbits, and not all people are designed to be, you know, T-Rexes. The real question revolves around methylation. When you know your methylation status, we can tell you that some people would actually benefit from a more vegetarian-based lifestyle versus other people with a different methylation status benefiting more from a protein-based or protein-rich lifestyle. Now, processing of foodstuffs and preparation are extremely key for either vegetarians or carnivores. Those are sometimes the very important links that determine inflammation. But no, pyrolurics by definition are not truly going to be affected one way or the other by just whether or not someone is a vegetarian or if someone is more protein-based in their diet. It's not a marker for that. For that one, you'd actually look more towards methylation for your answers.
Can you comment on how your emotions impact our...
Excellent, excellent question. And there's no simple answer for that. I want to first reference many of the old movies where, especially in the South, you would hear someone say, listen, during your pregnancy, keep calm, cool, and collected. Do your best to stay not rattled, because we don't want you to mark your baby. After about 40 years, we've now come to understand how critical emotional states can be because of release of hormones, neurotransmitters, and as we release those hormones and neurotransmitters, we now set off a cascade effect in our chemistry, both in our neurochemistry and that which passes on to the developing embryo or fetus. Now, those self-same hormones and neurotransmitters often have an epigenetic effect. They can literally shift genetic markers for oxidative stress and for other patterns that can radically change the overall constitutional capacity of the unborn or developing fetus or embryo, depending on the timing. The greatest changes can occur usually between day 16 and day 21 of gestation. Now, at that time, most women don't even know they're pregnant. Okay, that's most women. But that's where we can see the greatest insults and the greatest changes occurring as far as brain development is concerned, and certainly, therefore, emotional states and tolerances. This is where we see individuals who will shift from perhaps normal capacity to being somewhat anxious or to develop ADHD or depression later on in life. In other words, print for future capacities literally around those time periods. And that's where the huge domino effect of maternal excitation, maternal anxiety, maternal stress can be of huge, huge impact. Now, we're not absolving dads out there or the fathers for any of this, because oftentimes we know men that we can stress out our wives, our ladies, very easily. And how do we stop that? I don't know. If I had that answer, I'd be a trillionaire. We wouldn't be talking tonight. I'm just kidding. But the key thing here is that, yes, indeed, emotional stress. Remember, we talked about emotional stress as being a key for the development of pyrroles that can come into play, specifically as it depletes zinc and B6, which are both necessary for neurotransmitter development. And without appropriate neurotransmitter balance, we don't have appropriate cognitive balance. Development is going to be very, very skewed. So that's sort of the short answer to the question, believe it or not. But yes, indeed, emotional states can indeed affect development of the embryo and have a lifelong effect.
Can you just use P5P for treatment of pyrrole disorder?
That's a very interesting question. Typically, no is the answer. You typically need both zinc and vitamin B6 in some form, as well as maybe a few other elements, to treat pyrrole disorder effectively.
Can one be treated or tested by a psychiatrist or a primary care doctor?
Absolutely. It simply involves getting the right laboratory testing done at the right facility. But that is certainly what we're trying to do, is to help educate physicians around the world, literally, in the testing, interpretation, and the treatment of pyrrole disorder. Yes.
Hi, Dr. Mensah. I have all of the symptoms and have been tested twice by direct healthcare access to labs. Does this mean I have it, or does it, or not? Does it mean it'll eventually show up? I'm assuming that you probably didn't test positive. I was told because zinc was too low, it did not show up. But doesn't everyone with this disorder have low zinc?
Zinc levels can be quite relative in individuals with pyrrole disorder, and sometimes there's a low, as a mild, a moderate, or severe zinc imbalance with pyroluria. Now, the other aspect is, are you referencing perhaps either the genetic variant of pyroluria or the acquired variant of pyroluria? Pyroluria are going to show up quite positive. Individuals who have an acquired pyroluria may have that pyroluria secondary to stress, oxidative stress, inflammation, etc., and during calm times may not actually show up on testing. It may not mean that you don't have pyroluria, it simply means that you don't have it at that particular point in time showing up. But that's where a total evaluation of symptoms, testing, history, circumstance, family history, all those things come into play when your primary care physician is working through that process with you. Okay. The real short answer is that no, just because it didn't show up on testing doesn't mean that you don't necessarily have it. It might be the timing of the testing, the timing of the specimen. There are a few factors that could actually come into play to offset that. But once again, you can really under the supervision of a physician.
Could foods such as yeast, gluten, dairy contribute to elevated pyrroles?
Once again, not directly, but here's the thing. Individuals who are sensitive to these particular foodstuffs, the dairy, the gluten, usually have an inflammatory bowel disorder of some type, or celiac disease, or some type of colitis. Now, any of those bowel disorders can increase oxidative stress and inflammation. They are inflammatory conditions to begin with. Now, inflammation and oxidative stress can increase the number of pyrroles in the system. So once again, it is not the direct attack by those foodstuffs on pyrroles. It's the indirect effect of the foodstuffs leading to a worsening of inflammatory conditions or inflammation, which then increases the pyrroles.
Are there drugs that stop the pyrroles or hemes breakdown?
Well, I will say that I'm not aware of any. The thing is that because there are multiple routes by which pyrroles can be elevated, colds and flus can elevate pyrroles. You break your leg, that can elevate a pyrrole. A lot of physiological, environmental insults, such as being in an area full of toxic fumes. Many of these things can cause an increase in pyrroles. So drug therapy simply wouldn't be practical, number one. But no, as far as I know, there is no particular medication that lowers pyrroles. Because for somebody who's a genetic pyroluric, they'd be on that drug for life. And the whole point of pyroluria without drugs or pharmacotherapy. Okay.
Is Pyrrole disorder an indication of Lyme or Lyme co-infection?
That's a very good question. And I want to move to a slightly different phase of this discussion based upon that. We see many conditions where, let's rephrase, oftentimes if we test for pyroluria and we see a very strong elevation in that pyroluria, it could be a reflective marker that something else is going on in the system. We're very, very concerned when we see extremely high pyrroles of things like bone disorders, cancer. Sometimes Lyme disease can actually be coincident with elevated pyrroles because Lyme disease is another physiological stressor in the system, and that can elevate pyrroles. So sometimes Pyrrole disorder can be used as a marker for oxidative stress. In fact, that's one of its key utilities, as a marker for inflammation, as though somebody who would do a sedimentation rate in medicine. For all you doctors out there, a sed rate, a CRP, markers for inflammation. Pyrroles can also be seen as markers for inflammation, and therefore used not as a specific test, but as a sensitivity test for inflammation elsewhere. So you may see pyrroles when you have Lyme disease. When you have Lyme disease, you may see elevated pyrroles, but it is not a causal phenomenon. Okay, pyrroles don't make you more susceptible to Lyme disease.
Why is the omega-3 salmon fish oil does not help but causes harm in episodes? However, the omega-3 flaxseed oil is very helpful to calm my ambivalence and depression aspect of my pyroluria condition.
That's a very good question, and unfortunately I'd have to say there's a lot more that goes on with you than meets the eye. This one is not a clear-cut phenomenon. We would really need to know a lot more about your history, your gut issues, sensitivities, and so forth to clearly answer that. Typically speaking, an omega-3 fish oil in any form, an omega-3 oil in any form does not typically help pyroluria. Usually worsens it. So if you're doing better on one form versus the other, there's either something idiosyncratic or there's something else to the story that we're not very clear on. So I apologize on that one, but I think there's more to this story than meets the eye.
How do you find your methylation status?
Once again, testing for your methylation status is really the key. And as we said, we typically use direct healthcare. Now, we use a histamine test, and in actuality, our next webinar is going to be on methylation. And we'll talk more about that at the end of this segment. But we use a histamine test which measures the actual concentration of methyl in the system. Now, a lot of genetic tests are out there, and they tend to be actually qualitative in nature, and they're usually referencing some of the enzymes and not all of the enzymes in the 3 or 4 methylation cycles that we focus on. It's the end product, nonetheless, of all the methylation cycles that produces your methylation status. And we use a test called histamine test. It is a reflective marker of concentration of methyl. and that's what we use to determine your methylation status. But really, a simple blood test, the whole blood histamine test, which is fairly inexpensive, can be a very excellent guide to your methylation status.
Mhm. Hello, and thank you so much for your informative presentation. I'm interested in hearing more about genetics, the genetics or epigenetics of how pyroluria works. I have severe pyroluria according to my doctor. How likely is it that one of my parents has it or one of my siblings?
If you have a very severe pyroluria, then there's probably a greater chance that this is a genetic variant than it is an acquired variant of pyroluria. One of the things that I'm going to say, and I don't wish to offend anyone, but statistics are simply statistics. Individuals of Irish descent and Scandinavian descent tend to be quite well pyroluric overall. It is a well-known and documented fact that greater than 85% in our studies anyway of individuals of Irish descent or who are Irish directly are actually pyroluric. Now, I don't want to minimize this or to make fun of any given group. That's not my intention, but if we look at the stereotype of the Irish, hot-blooded, quick-fused, short-tempered, ready to brawl, all those wonderful stereotypes we see on TV. And by the way, I have quite a few friends that are Irish, so please no one stone me here. But these are also very much the symptoms of pyroluria. Okay? So we have to say that there's at least some symptomatic correlation between certain groups, more so than others. But we also know by testing that quite reasonably certain ethnic groups are a much more significantly high genetic pyroluric population. And two of the groups we mentioned, the Irish and the Scandinavians, typically are so. And with all the interbreeding that we have, and by that I do mean simply different ethnic groups getting together, when we have a family whose one parent is Scandinavian and the other one is Irish, well, watch out. Quite often the kids have quite the acquired pyroluria. Okay.
After someone starts on a treatment plan, will they see a progressive improvement or will it be 2 steps forward, 1 step back for a while?
That's a very good question. And usually it's not 2 steps forward, 1 step back when it's purely a pyroluria. Now remember, pyroluria doesn't exist typically in a spectrum all by itself. There are usually other biochemical imbalances that are present that are influencing or modulating mood, behavior, stress. If it's simply a pure pyroluria that is indeed causing the symptoms that a patient is concerned about, they will typically progressively do better within 2 weeks to 3 months. If it's a more complicated issue involving other imbalances, you may see somewhat of that phenomenon of 2 steps forward and 1 step back, only because there are other elements that are present that are not being treated and are affecting the overall progression of the condition. So as we talked about earlier in this discussion, somebody would say anxiety. Well, not only can pyroluria cause anxiety, so can copper overload. So can either under or over methylation. Now, each one of those takes a much longer time period to resolve. So even though a patient may have pyroluria and they're treated for pyroluria, and 3 months later, 4 months later, they still have anxiety, it's likely that the anxiety was due to one of the other imbalances primarily and only secondarily or tertiarily by the Pyrrole syndrome itself. So it's not always quite so clear and cut, but once again, for the singular Pyrrole condition that is causing the issue, usually there typically are not steps back. If you're able to move full force forward with the program, then you should see just very good results throughout the entire process, typically.
Does ongoing treatment need to be monitored with respect to the level of nutrients given?
Yes, in the sense that as times change and our circumstances change, we all encounter points of time where we're under greater stress than others. Our pyrroles may increase at that point in time, our capacities may decrease, and we really need therapeutic. That's where keeping in touch with your physician, retesting appropriately both come into play. And it's very, very key for the overall long-term prognosis for pyroluria, especially in those individuals who are genetic pyrolurics. Okay?
What if someone has been prescribed fish oils and has Pyrrole disorder? Should it be stopped immediately or weaned off?
Fish oils are not a drug, so you don't have to worry about the weaning process. You can pretty much just stop them.
We have an 11-year-old autistic boy who became autistic 2 days after his 3-year-old vaccination. He is very sensitive to various vitamins. He is also low functioning and his moods are hard to control.
Yes.
Can you please advise on how to work with him?
First of all, really our hearts go out to you. It's a we're talking about regressive autism here in this case, and regressive autism and autism in general is a multi-systemic phenomenon. There is no one simple approach. It is a multifactorial, multi-systematic approach that requires everything from gut evaluations and treatment therapies to dealing with oxidative stress, to dealing with inflammation, to dealing with the micronutrient imbalances. One of the things that's so important about autism and the spectrum disorders is that even though they may have similar biochemical imbalances to individuals with bipolar disorder or schizophrenia, the key is that the autistic children are far more sensitive. Instead of the effect perhaps being like a firecracker, the effect of these imbalances on these children is more like a nuclear warhead going off. And I don't mean to be trite here, but that's the kind of power that is present with inflammation and everything else that's happening in the autistic child. First of all, you have to find a really good practitioner who's experienced with dealing with children in the spectrum. And certainly Pyrrole disorder, because these kids are under tremendous oxidative stress. Pyrrole disorder is only one of the imbalances that we would anticipate seeing in an autistic child. Now, as far as mood and behavior are concerned, that might be one of the key elements to help sort of settle the mood and behavior. But it does not affect change in the cognitive developmental capacities of that child. That's where looking at other elements involving the whole oxidative stress phenomenon, low glutathione levels, low anti-inflammation elements in the system, that's where those pieces come into play. Certainly diet and gut inflammatory issues are also part of the regulatory piece. So our first suggestion is a very good practitioner. Now, if you'd like, you can give our office a call at telephone number 630-256-8308, and we'd be happy to look at your location and determine if there are any good practitioners that we know of close to you to help you with that. But that's going to be really the first key as far as your child is concerned. Pyrrole disorder is only one of the elements that's typically awry in children in the spectrum. It's a beginning, but it is not a factor that is going to shift the cognitive progression of your child. That's a very, very important piece, and I'd like to emphasize we'd be more than happy to see if we know someone in your area that we could refer you to.
What's the interplay between Pyroluria and MTHFR polymorphisms? How does one approach treatment? I have Pyroluria and my kids have symptoms but haven't been tested. My daughter is homozygous C677T, but the rest of us haven't been tested but are symptomatic.
That's a very good question, and I'm glad you brought it up. The idea here really is that when it comes to methylation, and that's really what you're referring to, methylation and pyroluria are tangential. They are not causative. They're not directly interrelated. They are tangential, meaning that treating the Pyrrole disorder does not resolve methylation challenges. Treating methylation does not resolve Pyrrole disorder. They're fairly independent. So they both have to be dealt with appropriately based upon testing, but don't expect that treating the one is going to fix the other. They do not interplay in that way. Now, If we move to the micromolecular level and we start looking at DNA fingerprints and we start looking at what the scientists out there will recognize as zinc finger motifs that are involved in DNA replication and so forth, those motifs do involve zinc, and if you are deficient in zinc because of Pyrrole disorder, that can affect DNA replication cycles, etc., etc. But it is not the direct pyrrole that affects those particular issues. Okay, so those are actually two different things. Directly speaking, if you feel your children have symptoms of Pyrrole disorder, get them tested. Find out for sure. If you are dealing with a methylation issue, you're going to have treatment for that methylation issue that will not be directly correlative to pyroluria. Okay?
How can patients who have low to moderate income benefit from these therapies? I am a psychotherapist and I recently started my private practice. Would love for my clients to benefit from these nutritional therapies. And then, I'm sorry, her follow-up question is the cost of the lab test and consultation for patients.
Okay, I want to reference the first question. For many individuals, now it all depends on really the cumulative nature of the imbalances that are resulting in your client's conditions, whether anxiety is one biochemical imbalance or several related. You know, if it's simply a pure pyroluria, this could be one of the most cost-effective treatment protocols around. It might involve as little as 3 supplements that one would have to take in a given day. Sometimes off the shelf, you know, these particular supplements may add up to maybe $30 or $40 a month. Okay, it all depends on the supplements and where you get them. But given the fact that many medications are now in the hundreds of dollars per month for some people, this could be an extremely cost-effective way of handling these conditions. Now, just for the record, once again, we're not against pharmaceutical medication. We're simply suggesting that we can do pretty well sometimes if for patients who are not on those meds by starting nutrient therapy programs, either in absentia of or coincident with those particular medications. But for those who are not on anything and they do have certain disorders like pyroluria, starting a nutrient therapy can be quite cost-effective. Now, I would contact direct healthcare access labs for issues regarding cost and consultations and set those kinds of things, and we don't. But it's definitely a good start in the right direction, and your patients can often receive a good deal of benefit and improvement without having started any medication. But I also want to say on the opposite side, folks, if any of you out there are severe in your imbalances, you're severe in your mood states, if you are unstable, do not hesitate to see your primary doctor or psychiatrist and follow those recommendations for medication if stability is warranted. These are not quick fix programs. They're not to be taken lightly, but you have to be supported as quickly as possible by whatever means is necessary for the sake of your life and everyone else around you. Okay? So please don't think that it's a quick fix or you don't need to do medication until their chemistry is really sort of supported better, and then they can, you know, look to be weaned off at the appropriate time period.
Have you seen a symptom of bedwetting in children as an association with pyroluria?
That's an excellent question. And my initial reaction to it is that no, biochemically, enuresis or bedwetting is not directly related to pyroluria. However, now let's sort of back up for a minute here and assess this. When we're looking at bedwetting, that can occur for a variety of reasons. For many children, there's an issue regarding stress. Pyroluria is a condition of stress intolerance in many cases. So if stress intolerance is the cause of a child's bedwetting, then we have to consider that fortifying that child's stress capacities may actually improve the bedwetting phenomenon. Now, for many children, it's not that. It may be simply poor bladder control or a variety of other things that they're not aware of, but it's certainly a viable question, and it's a good question. I'm glad you asked it, but we cannot say that treating pyroluria is going to cure bedwetting. Okay, it may help improve in certain cases, but the vast number of cases simply aren't related.
Should you test for Pyrrole disorder or methylation disorders first?
Yes. That is, test for both are actually. Many people will start with a Pyrrole test and then move to methylation, but the goal here is to treat all of your imbalances simultaneously, not one at a time. That kind of wastes time. These things can be treated, your methylation issues, pyroluria issues, metal toxicities, gut imbalances, all of these things can be dealt with simultaneously, which gives you a far better result in a quicker period of time than trying to do things sequentially, one disorder at a time. It can become very, very, very not only annoying but demoralizing to spend so much time without getting the appropriate results, whereas when you treat simultaneously, your results will show up much faster, on average.
How do you differentiate genetic and acquired pyroluria?
Question. Oftentimes, the intensity level of the Pyrrole itself, the Pyrrole test result, will give a clue as to whether or not somebody is a genetic or an acquired pyroluric. One of the other issues involves truly when individuals are really stressed, and that may not be a frequent phenomenon where you see the pyrroles flare up, whereas individuals who have just mild stressors seem to be pyroluric all the time. And looking at family history is also key. And I'm just going to have to go there. Quite oftentimes, if I see an individual walk in and the physical signs and symptoms are there, they walk into a room wearing sunglasses. And I remember when I was a child, I used to think, you know, these folks think they're cool. What are they doing inside this room, not outdoors, wearing sunglasses? What we come to realize is those people are photosensitive. They have a very strong tendency to bright light, so they wear sunglasses indoors. And this is also one of the signs or symptoms of pyroluria. There we would say that this is more of a genetic phenomenon than it is an acquired phenomenon. Okay? So the children or individuals who have the extreme sensitivities to light or to odor or sound or texture, I use the acronym LOST, the LOST syndrome, light, odor, sound, texture. These individuals, when these things are present quite strongly, oftentimes are probably more genetic in variation than acquired. So there's a bit of history with regard to the family, behavior of the family, alcoholism in the family, anger, rage issues in the family, ethnic background, and yes, testing. All those pieces are put together to determine the true nature, or at least to give us a very strong idea of the nature of this individual's pyroluria, whether it's genetic or acquired. It can become the most powerful element. If we know that you've got 2 or 3 siblings or at least one parent with pyroluria, the odds are you may have inherited it.
Mm-hmm. If majority of symptoms fit, yet my urine tested negative twice, then my blood through bioenergetic feedback tested positive. Not sure if you're familiar with that. What is your opinion?
We actually look quite firmly at counting the number of Pyrrole molecules, and that's done through the machines that are used with the urinary sample. I do not have a tremendous amount of experience with the other model, and have not as yet had a chance to evaluate it. But thank you for bringing it up, because we will take a look at that. Quite firmly, however, we still truly only classify the pyrroles, because they're lost through the urine. That's the key. It's counting the pyrrole molecules that are in the urine. That's when your zinc and vitamin B6 are leaving your system. When you're looking at pyrrole molecules in the blood, what you're seeing are just circulating elements that don't necessarily mean that you're losing zinc or B6. So there's one thing to have pyrroles in your system, it's another thing to lose them through the urine. And that's why we still sort of hold on to the idea that the urinary cryptopyrrole test is still the best and most definitive testing for that. Not to mention, you can see elevated pyrroles in the body by way of other disorders like sickle cell anemia or cancer or colds or flus or immune dysfunction or dysregulation or even inflammation in general. So elevated pyrroles in the blood is not the same as elevated pyrroles in the urine. Urine represents loss. That's if I have the mechanism correct in this other testing that you're referring to.
This individual is asking, you mentioned low levels of neurotransmitters specific to dopamine converting into norepinephrine. Is norepinephrine raised due to copper inhibition, hence the symptoms of anxiety, inattention, and manic-like symptoms? If so, does this indicate a need for a specific nutrient at higher levels than the others?
Great question, and I want to address the first part of that. In actuality, it would not be a copper deficiency. It would actually be a copper excess. Copper is a very potent, it's a very powerful micronutrient in pushing the dopamine pathway into norepinephrine. That's why individuals who are high in copper often exhibit panic, anxiety, depression, fatigue. For the scientists out there, in the area of glycolysis, the energy-producing pathway, one of the first of the 3 to 4, copper actually inhibits 3 different enzymes that are key in the glycolytic pathway that produce energy. So one of the things you'll see, one of the end results of copper toxicity is going to be fatigue. Not only oxidative stress, not only the, and that fatigue, by the way, can happen in the adrenal glands. So oftentimes high copper levels can produce adrenal fatigue. And many people out there are suffering from it. But if we back up for a minute and we look at the idea now, norepinephrine, ongoing production of norepinephrine, lots and lots of norepinephrine, that's going to push adrenal fatigue in many different ways. You're depleting yourself by to formulate more and more of this neurotransmitter from dopamine because of the copper excess. So it's not copper deficiency, it's actually copper toxicity that pushes the production of norepinephrine. Norepinephrine is your fight or flight neurotransmitter. It gets converted to adrenaline. So now you don't want to have this particular hormone or neurotransmitter constantly in your system, because that's what will produce anxiety, panic, and in the long run depression, as well as irregular mood states, as well as anger and rage. So we have to be very, very careful. Copper in toxicity can be a problem. Now, copper in deficit may be another problem, such as Wilson's disease. Now, if you're extremely low in copper by way of testing, then you may be evaluated for Wilson's disease, because in that disease, copper is sequestered in organ tissue, hanging out in the serum or the blood per se, where it should be normally counted. It shows up low there, but higher in concentration in your organs. So it's not, once again, copper deficiency that causes the biochemical issues that we're referencing. It's actually copper toxicity. Now, Dana, what was part 2? There was an if then, but in any regards, the part 2 isn't quite as relevant, because the part 1 really wasn't.
I think a higher dose of nutrients. This was the second part.
Well, the nutrients that would be utilized would actually be ones to help the body rid itself of copper. You don't want to do a traditional chelation, because that will also strip the body of the healthy metals that it needs, such as calcium and zinc. So it's about what all the imbalances put together are looking like. That's how you come to nutrient protocol, the appropriate nutrient protocol.
I have parents that are Russian and Polish and Scottish and Welsh.
Well,
I am severely reactive to chemical foods and soaps, additives, and with both catamenial epilepsy and severe form of pyroluria, OCD, bipolar depression, auditory hallucinations. For the most part, I have pyroluria under control as long as I'm able to take my P5P zinc and flaxseed oil as scheduled and eat my own cooked meals. However, I continue to have grand mal seizures bi-monthly by my menstrual cycle. Question, do you have any recommendations or suggestions?
wow. That's a loaded question because there's so many different things going on with you. With reference to your there may be a biochemical imbalance present there. There may not be, okay, by way of our testing. The first step is, I know you've probably seen a myriad of physicians and ordered lots and lots of testing, but the fact that this is cyclical around your menstrual cycle may suggest a copper toxicity, and that's because copper is related to estrogen. And what happens is that with individual females who are estrogen dominant individuals, the estrogen will actually cause a rise in copper. The copper can cause neuroexcitation because copper will directly stimulate nerve cells. Study done back in the 1940s where they put a nerve cell in a petri dish and they added only 5 micrograms of copper. That nerve cell lit up like no one's business with activity. So we know that even from some 70 years ago, that, I hope my math is correct on that, that copper can cause excitation of nerve tissue. So now with brain cells, certainly excess copper can produce a variety of things. Now, I'm not saying that this excess copper is definitely the cause of your increased epileptic activity, but when we're looking at specifically around menstrual cycles, then we have to evaluate the roles and the correlation, between hormones like estrogen and what elements would be affected by those particular hormones. And we do know that a major micronutrient that's affected by estrogen is copper. And we do know copper can cause neural excitation. So this is one avenue that you might consider. I'm not saying it's the answer, and I've not evaluated you or not shared this discussion with any of your physicians, but I think it's one that should simply be assessed because in the worst case scenario, it can simply be ruled out.
Mm-hmm. And now along these lines, can pyroluria cause a copper overload?
Not directly. Pyroluria can assist copper in being elevated because of the depletion of zinc. So zinc and copper tend to keep each other in balance, but high copper levels will suppress zinc without a pyroluria being present. Now, if you add pyroluria into the picture and you strip the body of that zinc that is there to help balance the copper, you have an artificially or a relatively elevated copper level, even if the absolute numbers for copper ring stable, normal, or quite level. The body sees the relative or the percent free copper as being much higher than it would be if the zinc were elevated. So indirectly, pyroluria can produce sort of a relative hypercupnia or high copper level, which can then cause a variety of difficulties in the system that we've already talked about. But once again, directly no, pyroles don't cause copper toxicity, but they can actually worsen the phenomenon and may indirectly worsen it by way of lowering zinc levels.
In Carl Pfeiffer's book, Nutrition and Mental Illness, a person states that she gets dizzy and paranoid when eating animal foods. I have the same reaction. Is this a common reaction for people with pyroluria?
I can pretty much tell you no, it's not common. I'm not going to say it's impossible, but it's not necessarily common. I would say which animal food Different foodstuffs, of course, contain different biochemical elements. Some are more rich in zinc, some are more rich in different proteins. A variety of things come into play. It's too much of a gross generalization to simply put animal products there, as much as it would be a simple gross statement to say that all vegetables. We know that different vegetables have different concentrations of folates, they have different concentrations of zinc, they have different concentrations of a variety of elements, and it's the same for different meats. So we really would have to take a look to determine, number one, the type of meat, the processing. It might even be the fats that are in the meat that you're eating. So that's a very, very complicated question with, unfortunately, no simple answer.
Is it safe for a woman with Pyrrole disorder to continue nutrient therapy while pregnant and breastfeeding?
Okay, we have gone through this particular issue several times in general, not during this session here. We do not believe it to be safe for pregnant females to be on therapeutic dosages of supplements that would treat Pyrrole disorder. We have no studies on the effect on the developing embryo fetus of supplements at that concentration level. It is something where we're now affecting literally not only neurotransmitters, but literally the DNA and different molecular issues in the development of the child. If you are currently pregnant and you're taking therapeutic dosages of these supplements, I would actually suggest you stop it, okay, and reevaluate with your practitioner to something more, maybe a multivitamin level, as opposed to a treatment level for Pyrrole disorder. We have no statistics, and we want to be protective of your child because that is the most important thing. Of course, you're important too, but that is extremely important that we protect your child at all levels. We simply don't have the data to indicate that that's a safe thing to do, and we would recommend against it.
My wife is a proponent of using cannabinoids as medicine. No THC at all. Are there any reasons why oral cannabinoids would interfere with a vitamin B6 and zinc regimen?
That's another interesting question, and we've come across that one before. The issue is not so much that those particular elements are going to affect the Pyrrole disorder. It's just that they may sort of mask the effect one versus the other, and you might not know what's really helping in this particular condition. So concomitant use may not be the best way to go if you're looking for real answers and definitive cause-effect correlations based upon improvement of symptoms by way of treatment.
Can correcting Pyrrole disorder with nutrients help with short-term and working memory deficits?
Actually, yes, it can. It all depends, of course, on what the real causes are. Now, if somebody has dementia, whether it's Alzheimer's-like, Parkinson's or Parkinson's-like, or from concussions and so forth, head trauma, loss of consciousness, seizure disorder, no, it's not going to improve a pyroluria treatment level. The key here for short-term memory is that if your short-term memory is related to a deficiency of, say, vitamin B6, or specifically and only that which is influenced by zinc, then indeed treatment for the pyrroles should show some improvement in the short-term memory. But we know that short-term memory issues can be seen in individuals who are just zinc deficient alone, who don't have pyroluria per se, at least not on testing. So you kind of have to really determine the nature of the short-term memory, number one, and then with biochemical testing, evaluate what the levels of other micronutrients are, and then approach treatment from there. But in one vein, we could say, certainly short-term memory can improve by helping pyroluria, but it's very case-dependent and very individual specific.
I've recently been diagnosed with pyroluria, copper-zinc imbalance, mild undermethylation, and high estrogen. I've only started medication 4 weeks ago. My question relates to weight. During the past 5 years, I've put on a significant amount of weight, about 55 pounds, despite very clean eating and daily exercise. Do you think this is related to the pyrrole levels, or should I still be seeking further medical avenues?
Oh, no. Weight gain is more related to the pharmaceutical aspect of things. It's not related to the pyrroles. When we talk about weight and pyroluria, there's an abnormal fat distribution. There's not abnormal fat gain, and there's a very big difference. Where the fat is located on your body is different than acquiring fat on your body. Okay, pyroluria does not cause weight gain. Okay, pharmaceuticals that do that.
How do you view the role of psychotherapy in the treatment of pyrrole disorder?
Wonderful question. Absolutely wonderful. The key here is to recognize that individuals who are pyroluric are in actuality not of balanced biochemical mind. Therapies of the cognitive nature are geared towards individuals who are cleanly able to process or to help move them to that state. Now, once you balance the chemistry, once you help correct the pyroluria, those individuals will be much more receptive and they'll do much better on those therapies than if you try to initiate those therapies without having treated the pyroluria first. You can try them simultaneously, but I think your best results are going to be seen once the pyroluria is treated. Individuals then respond extremely well to those other therapies.
I've read that omega-6 should be supplemented rather than omega-3. Is that true? Are there other supplements to help the body process omega-3s?
Could you repeat that?
Yes, I'm sorry.
Could you repeat that? I'm sorry.
She said, sorry, I want to delete it.
Well,
she's saying she read that omega-6s are better than omega-3s.
In pyrolurics, yes, that is correct.
Okay. And I think is there a better way to help the body process omega-3s?
Well, I want to put it to you in this light. Usually, omega-6s tend to be more what we call pro-inflammatory if in the wrong proportions. And omega-3s tend to be anti-inflammatory, typically. In an individual who's pyroluric, that gets switched around. The omega-3s tend to be more pro-inflammatory, and the omega-6s tend to be more anti-inflammatory. So if a given person is a pyroluric, it would not behoove them to take omega-3s for the most part, because they would be actually starting the system into a pro-inflammatory cascade of which they're not going to derive much benefit. So the real utility of omega-3s is really sort of in question when it comes to pyrolurics in general. That's why it's actually important to know if you are a pyroluric, if you're really considering using omega-3s or fish oils, because it really may not be a good idea. Even trying to process them would simply create or increase the pro-inflammatory cascade in your system, and you really won't do much better.
Are foods remediated by the treatment of pyroluria, or how are they related? Okay,
the first part is fairly concrete. No, food allergies are not remediated by the treatment of pyroluria. Remember, it's the other way around. It's the allergies, the inflammation in the system, the release of leukotrienes, the release of cytokines, and other inflammatory markers, including histamines, the inflammatory elements that actually cause the stress that leads to pyroluria. Okay, treating pyrrole disorder will not improve or actually heal those other situations. It doesn't work that way. These are separate issues. Now, having said that, I'm going to sound a little bit slightly contradictory. If the zinc is an issue, we know zinc is involved in immune regulation, inflammatory changes. improving zinc levels may actually help the body respond better to those allergens. However, it doesn't remove the insult, and it does not remove the overall sensitivity. It may decrease the intensity, but treating pyroles is not going to get rid of your allergies.
Can pyrrole disorder cause damage to the nerves?
No, not typically. And even then, damage is a very strong word. And I was sort of thinking about our discussion earlier with regard to copper and copper toxicity being neurostimulatory. The elements of pyrrole disorder, and I know somebody's probably thinking about vitamin B6 toxicity, which in terms of utility, that can be a big problem. When we think of it that way, excess vitamin B6 can cause peripheral neuropathies, can cause all sorts of issues with regard to nerves. So a deficiency of vitamin B6 should typically not be a cause of trauma or destruction to neural tissue. So we're going to have to kind of say no on that one.
Can a double mutated COMT and double mutated VDR vitamin D receptor and heterozygous MTHFR 1298 and 677 also lend themselves to pyrrole disorder? My son became sick at age 14 and is now 32. His diagnosis has gone from depression to bipolar to schizoaffective bipolar type to paranoid schizophrenia. I am thinking this pyrrole disorder may be causing us his ability not to be able to, I'm thinking this pyrrole disorder may be causing us to not be able to control hallucinations and clozerol.
Excellent question. And to simplify the question, it's basically we have some methylation challenges by testing, and we want to know if the pyrrole disorder is actually hindering him from getting better. And the real question that I would have is that, now I want you to remember, and we'll talk about this more in our next webinar about methylation, these SNPs that we are talking about, these mutations in these different enzymes, the COMT and the other ones, these are not truly reflective quantitative assessments of methylation. They're at best qualitative, and that's only a fraction of the methylation pathway. But you're right in that methylation is a key consideration in your son's pathology. Now, here's the real deal. We want to know, firstly, if it's the methylation, either over or under methylation or normal methylation, that is moving your son into these diagnoses, or is at least in part related to some of these diagnoses, or if it's the pyrrole disorder. Each one of those diagnoses you've mentioned over time can indeed be supported or caused by or become part of by pyrrole disorder in and of itself. So the real question is, what is the major contributor biochemically to your son's condition? And knowing that, or at least having some idea of that, you can kind of make a better assessment about how to treat it and if there will be any improvement or even resolution of at least some of those symptoms. But it's not the SNPs alone or the Pyroluria alone that tell the story. It's actually the combination of all the above. So we would really kind of have to see those test results and see the individual going back to history and even assessing if the diagnoses are more accurate than not. But the chemistry tends to be very, very telling. And I think additional testing would prove to be very enlightening for your son and quite revelatory. Okay. Give us a lot of good information.
Last month, Dr. Mensah actually did an entire webinar just dedicated to schizophrenia and schizoaffective disorders. So please go to our website, mensahmedical.com, to check out that 2-hour presentation. I think it would be very, very helpful for you. Question is, I understand why omega-3s are not a good choice for pyrrole disorder persons, but what about importance of DHA for the brain? Is it important to supplement with this? If so, how can you go without using omega-3s?
Well, the second part is more relevant. If so, the question becomes relative significance. These elements are of, and I know there are a lot of people who are going to respond to this in one way or the other. DHA and other elements with regard to omega-3s are most critical in developing children. Okay, those issues I certainly would never say to somebody, or almost never say to somebody, your child is 2, your child is 3, your child is 4, don't give them any omega-3s. Okay, we would have to find an interesting balance for the pyroluria child who is age 3 and, you know, is still having that developing brain and the need for the fish oils. Now, in an adult person, okay, then for the most part I would say you pretty much need to stay away from DHA, you need to stay away from the omega-3s, okay, because we've seen it far too many times in clinical history where individuals who have gone on those omega-3s or at least slowed down at best their improvement while trying to combine the omega-6s and the omega-3s. Not a good idea statistically. Okay? So it's simply one of, you kind of have to focus more on the omega-6 pathway and the positives for pyroluria as opposed to the omega-3s. Okay. Once again, I understand where you're coming from because there's been so much work and discussion on the importance of fish oils and the omega-3s, the importance of cholesterol, the importance of fats. All those things are very high in the research now, very frequented and very popularly asked questions. But remember, we're talking about this one specific case of pyroluria where that's simply not the best idea.
Is normal dietary intake of fish and therefore the oils generally at acceptable amount? I do not currently take fish oil supplements, but I do occasionally.
There's nothing wrong with occasional utility, of occasionally having fish. We're not saying to eradicate fish from your diet or fish type of products from your diet. What we're simply saying is that you can't take concentrated substantive amounts of supplements that are omega-3 fish oil based. Okay, we all need some level of omega-6, and truth be told, it's the omega-3 to 6 to 9 ratios that we're most concerned about. And when you're taking the omega-3s, you're pushing the higher omega-3 ratio compared to the 6s and the 9s, and that's what gets us into trouble when we have pyroluria. So we tend to simplify the discussion by kind of saying, you know, just focus on the 6s and leave the 3s alone, because really in our diets we get omega-3s in small concentrations from various sources. So we're not saying absolute abstinence. What we're saying is no need for overt super supplementation. Okay, that would not be a good idea. Enjoy your fish.
Can pyroluria cause learning disability?
Ooh. Excellent, excellent question. Indirectly, I think, when we start talking about zinc deficiencies, when we start talking about those things that allow for cognitive development, those things that allow for stress control, indirectly poor focus and concentration. Okay, zinc deficient individuals, vitamin B6 deficient individuals, neurotransmitters that are not functioning properly. If you don't have your brain cells talking to each other, you can't process. If you can't process, you can't learn. If you don't learn, well, we know the consequences in society. Not a good thing. So indirectly, yes, Pyrrole disorder can contribute to some learning difficulties. But that's assuming that we have the proper neural structure and neural network in place, and that it's simply a matter of neurotransmitter dysregulation or dysfunction. Otherwise, if we're talking about structural abnormalities that are present in the brain that are hindering development or learning, that's a whole other issue. In which case, it's the stress, and usually the oxidative stress, that is showing a reflective pyroluria and not a causal dysfunction in learning.
Listening to all these questions about SNPs, is it a good idea to have genetic testing to reveal more about a person's biochemistry?
If you have, I always say, you know, don't go looking for trouble. If you're doing okay, if you're functioning okay, if life is just a joy, then really why put yourself through that? It can really kind of lead you to now looking for answers to questions that don't really exist. Now, if there are challenges that are present with you or your family members, then I can understand the search for testing, for genetic testing, and so forth. But you know, right now, when we're talking about genetic testing, especially for methylation, okay, we really don't have the answers that we're looking for from these genetic tests. I want to share with you, there isn't a person on Earth walking right now that doesn't have at least 1,000 genetic mutations. Okay? So if you want to go find trouble, you'll find it if you look hard enough. But the question is it debilitating? Is it disarming? Or is this just a mild curiosity? Looking for the answers for a mild curiosity will get you some interesting questions. The question is, are they relevant and are they going to change your life? Have some alterations in your life cycle for whatever reason because you're having difficulties, then by all means, then look for whatever testing you can to help change that scenario. But if you're moving along just kind of fine in life, then I would really suggest not going there. Okay? Everybody's an individual. You can do whatever you want to do that makes you feel happy. But for many people who have certain perfectionistic tendencies, when they find a problem, they've got to now see the smoke and they've got to find out where that fire is coming from, even if it was something that was put out years ago. So just be careful is what we're saying. You look for it, sometimes you find it, and now you're committed to working out something that really isn't a huge problem. If there is a problem, on the other hand, then by all means, look for whatever testing you can to try to help you in whatever way you can.
Is pyroluria comorbid with autism?
Excellent question. And in a significant number of autistic children, the answer is yes. And why is that? It's because autism, truly by definition, is a condition of oxidative stress relative to cerebral capacity. So in the brain of autistics, thanks to Dr. Walsh's amazing database, he has the world's largest biochemical database of chemistries related to autistic children. And in that database, we find that children with autism are extremely, extremely susceptible to oxidative stress, and as a result, many of them are pyroluric. Now, once again, it's not the pyroluria that's causing the autism. It is the pyroluria that is a reflective marker of the oxidative stress and inflammation that's present in the brain and in some areas the body of autistic children. So just to sort of clarify that point.
Mm-hmm.
I want to add also, in autistic children, there is the behavioral component that is affected by pyroluria. So the children who are very racial, very angry, very cyclical in moods and so forth, treating the pyroluria alone can help with mood dysregulation in autism. So I meant to bring that point across. It's very, very key. Thank you for bringing up that question.
How do you handle or interpret patients with paradoxical reactions to supplementation? What does this mean diagnostically?
That's a great question. Unfortunately, it's a very, very case-by-case answer. Quite earnestly, there's some chemistries that lend themselves to fear, and the fear of actually getting better. Now, that sounds like I don't mean for that to sound like a slap in the face to many individuals out there, but I can tell you that there are a smaller segment in the population of individuals who will truly claim that they have paradoxical effects when they do not. There are some individuals that truly do seem to have paradoxical effects to higher concentrations, but not necessarily to smaller concentrations. The key there is to try to titrate them up slowly to therapeutic dosages, and this can take months in order to help them adjust to taking larger concentrations that are therapeutic in nature, or rather in concentration. So we have to be very careful in assessing what happens and why. The difficulty is that many people will be on multiple supplements simultaneously. And when they take a given supplement, they may think they're reacting to that particular supplement, but it may actually be a reaction or a cross-reaction between a few different supplements that are present in the system, and how they're affecting DNA transporters, how they're affecting enzymes, or different neurochemical pieces. So it's not a simple question. There is an answer, but the answer is unfortunately very case-specific.
You said you see physical signs of pyroluria in children. What are the most common for children?
I would say that, and this is very age-specific, but if we're looking at the age 2 to 4 or 2 to 5 category, white spots on the fingernails certainly are very key. Oftentimes pale skin, oftentimes rash, eczema can sometimes be present. Individuals who sometimes have, and I know a lot of kids do, but sometimes have a little bit of a bigger belly, and that can be due to bloating. That can be due to a lot of things, so I don't classify that as one of the major signs of pyroluria. But phenotypically, blonde-haired, blue-eyed children, red-headed children, red-headed and green eyes, these are quite classically children that we just kind of go, wonder if they're pyroluric, and quite often they are. Okay.
Does earthing or grounding help pyroluria?
I'm almost surprised to hear that question, but at the same time I'm not. And the answer truly is no. It can help with certain symptoms that might be cross-referenced with pyroluria, but it is not a treatment for the pyroluric condition. From a molecular basis, molecular perspective.
And we've said this before, but we're getting more questions on it. Where do you go for testing?
Okay. Depending on your region or location, there are actually quite a few labs now that test for Pyrrole disorder. The most significant thing that I can tell you is that I look at those who've been doing it for the longest period of time. I look for the pioneers in the testing and those who really are quite sensitive to all the nuances of what can happen when a result shows up and it looks questionable. For us, it's direct healthcare access to labs in Chicagoland. They are indeed pioneers and forerunners and leaders in laboratory testing. We've been using them for over 40 to 50 to the organizations that we've worked with, and just had tremendous consistency and tremendous accuracy. So not to mention great personal service. But that would be probably one of the key labs that we look at. Now, to be fair, other labs in the country, there's a lab in Kansas City that does Pyrrole testing. And there are a few other ones. I would look at the ones that have been around the longest, though. And certainly, once again, direct healthcare access to labs is the one we look at as being the most consistently accurate and meticulous with regard to their methodology.